We're tracking several coronavirus headlines. Joining us now is Dr. Monica Gandhi. She's a professor of medicine at the University of California, San Francisco, specializing in infectious disease and global medicine. Nice to have you with us. Thanks so much for joining us. I want to start with the booster potential, because much of the world is desperate for just a first shot. The Surgeon General today defending the rollout of booster shots in September for Americans. Obviously, we want to take care of our own people, but what is the right call here, given that the pandemic is global in nature and that a third shot for us could mean other countries continue to go without even a first shot?
Right. So I think a lot of people are concerned about what you just said, including me, because there is a limited supply of global vaccine. The best thing we could do to reduce the pandemic, to get variants under control, is to get the world vaccinated. And my concern about a third shot for immunocompetent Americans, not immunocompromised, we absolutely need that, and that's being rolled out right now. But for immunocompetent Americans, one thing about us is that we have what's called cellular immunity, that we have memory B cells that produced by the vaccine that will produce new antibodies if we ever see the virus again. And we also have T cells, which are keeping us away from severe disease. So it's not clear that the science dictates that we really need this right now for immunocompetent Americans instead of the rest of the world.
So you think the better call, the more ethical call, would be to distribute it to the rest of the world first before a booster shot for every American?
Yes, I think that is the more moral, ethical call. And fundamentally, it's not just ethics. We are actually completely in this together, and we cannot control this pandemic unless we get other nations vaccinated.
Okay, I want to move on to the U.S. reporting its highest daily COVID case count in nearly 7 months on Thursday. We're obviously paying close attention to the Delta variant, but what is going on with this Lambda variant? We know it's devastating South America right now. It's already in more than 40 states in this country. And Japanese study recently found that it may be more resistant to COVID vaccines. Is that right?
So the thing about the Lambda variant is it actually is not as transmissible as Delta, which is why it will not likely take over Delta in this country. We, unfortunately, have been under this Delta wave. It started in March in India, and then it came here. And this is really one of the most transmissible viruses we've ever seen. The concerning thing about the Lambda is not that we're resistant in terms of what's called our T cells, but it looks like our antibodies, which are our first line of defense in the nose, are reduced to the Lambda variant, which means we will have more sort of mild and breakthrough infections. So we don't want Lambda to take over. We need to get over Delta. And really, it's fundamentally a matter of getting more and more Americans vaccinated. First shot, second shot, the ones who have chosen not yet to get vaccinated.
Yeah, it's like every time you hear a new variant, it's just more bad news, right, when you can't even comprehend the Delta variant at the moment.
Right,
Now that the vaccines are getting FDA approval, are we going to see more restrictions, especially heading into the winter when people can't be outside as much? Should we, for example, be rethinking travel?
You know, I think what's going to happen with the approval, which is supposed to happen as early as tomorrow, which is exciting, is you're going to see more mandates. And so what has changed in this country is we gave it out to everyone. April 19th was kind of the day that anyone could get it. And it didn't work. A lot of people chose not to get it. I think you're going to see more vaccine passports like Europe is doing, that you need to show your vaccine before you can get into this establishment. New York, San Francisco, LA are all doing that. And the second is settings of vaccine mandates, healthcare workers, teachers, increasingly employers. And what the approval does is it opens the door for mandates, which is something, by the way, that we have had in this country since 1905. The Supreme Court actually had a ruling in 1905 that in the setting of a public health emergency, unless there's a contraindication, it is ethical to essentially make it required to take a vaccine.
And what about the people who have been resistant thus far? A big reason a lot of people give is that it's not FDA approved. Do you think that the people who have been resistant will now go and sign up for the vaccine when it is approved?
Yes, I actually think there's a big psychological problem in terms of having people have to sign a consent for the vaccine, which is what we've had to do under the emergency use authorization. I actually think there are a lot of people who are waiting for that full approval, and that could not have happened sooner. It should have happened sooner than this, but we're happy that it's finally happening because, yes, I think a lot of people are waiting for this day to go ahead and sign up to get the vaccine.
And finally, before I let you go, the British government is starting an antibody surveillance program to gauge reinfection rates for those who previously caught the virus and also to measure breakthrough cases. So, of course, we've learned a lot over the last 18 months, but what to you are the critical questions that we still don't have answers to when it comes to COVID-19?
You know, essentially what we don't know, a couple of things. Number one, hopefully we're not going to get a variant that will totally evade our vaccines. Even Lambda isn't going to evade what's called hospitalization or T-cell immunity from vaccines. But what we don't know enough about is how long our immunity lasts and the importance of T cells and how long that's going to last. So it's the right thing to do to keep on surveilling. Unfortunately, we think that coronavirus is going to become what's called endemic. I don't think we're going to be able to eliminate it. But the only good thing about the endemic state of a virus, which I know sounds depressing that we can't eliminate it, is that we can always monitor. We're always going to be looking for outbreaks. We have the tests, and it's going to become this thing where every winter, in every season, we're going to test for influenza, we're going to test for RSV, which is respiratory syncytial virus, COVID, and we have developing treatments that are coming for COVID so that even if you have a mild symptomatic breakthrough, we can give you Tamiflu if you have flu, and we can give you hopefully an antiviral if you have COVID, and we will be able to eventually learn to live with this.
All right, Dr. Monica Gandhi, thank you. You're such an excellent resource for us. We appreciate you joining us tonight.
Thank you.